Hi, thank you all for joining us today. If you need access to record or would like to ask a question, please indicate so in the chat. We will limit questions to one question per outlet today, and we're limited to 1 hour. If there are remaining questions in the queue when we conclude at noon and you feel your question hasn't already been answered, please send them in the chat or by email and we will work to get you a response in writing.
Recording in progress.
Okay, Dr. Vanderhoff, we have granted all recording permissions and it is 11:02, so I believe we can begin.
Wonderful. Well, good morning. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Since the authorization of a COVID-19 vaccine for those ages 5 to 11, school-aged children are now joining the ranks of so many adults who are well protected from COVID-19. Already in Ohio, more than 77,000 youth ages 5 to 11 have started the vaccination process. Statewide, this brings the total number of people ages 5 and older who've been vaccinated to more than 6.6 million. And more than 60% of Ohioans 5 and up have received at least one dose. However, the rise in cases and rising hospitalizations that we are again seeing tell us we still have more to do. Unfortunately, there remain many Ohioans who are eligible to receive a vaccine, but remain vulnerable to the virus because they haven't yet received their first dose of the COVID-19 vaccine. For those Ohioans who haven't yet chosen to be vaccinated, I urge you to talk to your doctor or pharmacist and get the facts about COVID-19 vaccines. Many people remain concerned about side effects. First, many experience little or nothing in terms of side effects. And for those who do, they tend to be mild and symptoms that last only a day or two. We know there's a lot of misinformation out there, but rest assured, these vaccines are safe and effective. The COVID-19 vaccines are under constant, rigorous, ongoing safety evaluation. And despite the fact that more than 195 million people have been fully vaccinated in the US, including more than 6.6 million Ohioans, these vaccines have maintained a remarkable safety record. Let's also remember that COVID-19 can itself be an unpredictable virus, causing one person to become profoundly ill or suffer lasting health effects, while barely affecting a friend or a family member. But none of us need to take chances with COVID-19 because our vaccines create a reliable, protective immune response, and they reliably protect us from severe illness, the kind of illness that can result in hospitalization or death. Vaccination remains especially important because the Delta variant appears to have gotten a second wind. Hospitalizations have significantly increased, and right now, 1 in 7 patients in our hospitals has COVID-19. Yesterday, there were more than 2,800 patients in our hospitals with COVID, and more than 800 of our fellow Ohioans fighting COVID in the ICU. In the last 21 days, hospitalizations have in fact increased by 23%, and ICU admissions have increased by 15%. These numbers are quite simply going in the wrong direction. COVID-19 cases, similarly, are trending in the wrong direction. Yesterday, more than 6,300 cases were reported from the previous 24 hours. That's the highest number we've seen since early October. More people are getting sick and more are being hospitalized. But getting really sick with COVID-19 is a risk we don't need to take because our vaccines are so good and are readily available across the state. So if you're still unvaccinated, do yourself and your loved ones a real favor. Get vaccinated now. Don't bring tragedy that could be easily avoided to your family this holiday season. Make the safe choice and get vaccinated. Also, if you're due for a booster, go out and get your booster dose. As we look forward to Thanksgiving, remember that in addition to COVID-19, this is the season for flu and other respiratory viruses. And you really shouldn't gather with others if you are feeling ill. If you're sick, stay home. Whenever we do gather, we need to think about ways to keep our gatherings safe and to reduce the risk of spreading respiratory illnesses like COVID and flu. How's the weather? Can you gather outside? Or can you open some windows to improve ventilation? Consider limiting the number of people at your Thanksgiving celebration and be mindful of where we are in this pandemic. And getting vaccinated is the best way to protect ourselves and other people. Finally, I want to remind you that this is the time when we're approaching the first deadline to enter the Vax to School program. That's this Sunday, November 21st at 11:59 p.m. Ohioans between the ages of 5 and 25 who've received at least one dose of the vaccine are eligible to win one of 150 $10,000 scholarships or one of 5 $100,000 grand prize scholarships. If you don't make the deadline of November 21st, rest assured you can still enter, with the final deadlines on November 28th and December 1st. However, the sooner you enter, the better, as you'll be eligible for all the drawings if you enter by this Sunday. The Ohio Vax to School prize scholarships are awarded to Ohio 529 Scholarship Plan. So that's the form they come to you with, 529 College Advantage Scholarship Plan. And they can be used at the Ohio College, University, Technical, Trade School, or career program of the winner's choice. Winners will be announced November 29th through December 3rd. The 150 winners will be announced daily at 3:30 p.m. on Instagram and Twitter. And the grand prize winners will be announced on Friday, December 3rd on the lottery broadcast at approximately 7:29 p.m. Now today, I am joined by two of my colleagues to further discuss COVID-19 and in particular, children's behavioral health in Ohio in the COVID era. First, I'm joined by Dr. Joe Gastaldo, who's Director of Infectious Diseases at OhioHealth. Dr. Gastaldo, we're hearing more and more about so-called long COVID and its lasting impacts on a person's health. In fact, there was a recent study in JAMA that suggests that more than half of all COVID-19 survivors have symptoms that linger more than 6 months after recovery, which is remarkable. Can you tell us what is long COVID and who's at risk for it?
First of all, Dr. Vanderhoff, thanks for having me. It's my pleasure and honor to be here. You know, death and hospitalization isn't the only negative outcome from COVID. In fact, this December, Dr. Vanderhoff, it'll be the 2-year anniversary when this virus was first identified. We have learned a lot since then, but we still have much more to learn. One area where we are just beginning to learn about is something called long COVID. Long COVID is a serious risk that can be quite debilitating even for previously young and healthy people. In essence, long COVID is somebody who has COVID. They are out of isolation, they recover, but they're not necessarily back to having no symptoms. These symptoms can be quite debilitating for some people, and they can be quite long-lasting. Symptoms reported include headache, memory deficits, mental fogginess, shortness of breath, and changes in taste and smell. They're quite variable from person to person. I personally, in my office, have seen persistent symptoms in patients for more than 6 months. The NIH and other medical institutions throughout our country are starting to do a lot of research in this area. Anybody who gets COVID is at risk for long COVID. This includes children, teenagers, and young adults. Treatment-wise, we really don't have an understanding of what this disease yet, and subsequently, we don't have recognized treatment. It's basically supportive care at this time. Nonetheless, though, the best form of protection for long COVID is not to get COVID to begin with. And I think everybody knows the best tool you have in the box for that is a safe and effective vaccine.
Thanks so much. Well, it certainly sounds, Dr. Gastaldo, like long COVID is something we want to do our best to be protected from, especially given the fact that COVID, as I shared in my opening comments, is spreading widely and rapidly still here in Ohio and across the country. Clearly, if you don't get COVID in the first place, I'm hearing you say, you're not going to get long COVID. And I think about that, and then, of course, also think about the fact that here we are in the midst of cold and flu season. And I'm hoping maybe you could tell us a little bit more about how do respiratory viruses spread from one person to the other? And what are some of the preventive measures that Ohioans really should be using to protect themselves, especially as we're approaching the holiday season beginning with Thanksgiving next week?
Thanks for the question, Dr. Vanderhoff. And I can tell you, as an infectious disease specialist throughout my professional career, I've always had an appreciation for respiratory viruses. You know, before COVID, we were all very familiar with influenza, but there are many other respiratory viruses out there that we typically see more so during the winter months. And we will likely see more SARS coronavirus 2, the virus that causes COVID-19, more so in the winter months. Respiratory viruses, including this coronavirus, essentially all spread the same way. Anytime we talk, sneeze, sing, there are respiratory droplets that can come out of your nose or your mouth. Some of those droplets are smaller in size and they can stay suspended in the air, but they are all spread the same way, including COVID-19. Moving forward, I hope that one of the things we learn from this is that all of the respiratory viruses, including COVID-19, have many similar symptoms, and we all really need to be cognizant of that. If people aren't feeling well, if they have any symptoms of COVID-19 or a respiratory virus, they should really stay home, take care of themselves until they're feeling better. In the setting of what we have going on now for COVID-19, if somebody is symptomatic, they should be tested. When you look at the symptoms of COVID-19, influenza, and other respiratory viruses, there are many similar symptoms that overlap, and it's really not best guidance to really say, oh, you know what, I just have influenza. You should really get tested if you have any respiratory virus. When it comes to protecting yourself, it kind of goes back to know what we know. Get a vaccine for COVID-19, get an influenza vaccine. We've had flu shots for years. The influenza vaccination is officially FDA approved and CDC recommended for everybody above the age of 6 months. We have many different types of flu shots. A lot of people are going by dated guidance that if they have an egg allergy, they should not receive a flu shot. There are many different types of flu shots that are out there. When it comes to flu, don't forget about our friend Tamiflu or oseltamivir. That's an anti-influenza pill. Hopefully in the near future, we will have another tool on our box, oral antiviral medications for COVID-19. But really, those are the only two medications that we have. In essence, all respiratory viruses can overlap in their symptoms. If somebody has symptoms, I would kindly ask them to stay home and take care of themselves and not potentially be a vector of spreading any respiratory virus, including COVID-19.
Well, thanks. Before we close with questions for you, I just want to extend that a step further. There are still Ohioans who are thinking about the vaccine that are on the fence, or Ohioans who are thinking about taking their child for a vaccine but haven't scheduled it yet. Given your knowledge, your experience in infectious diseases and with these respiratory viruses, what more would you offer them in terms of confidence and encouragement for the COVID-19 vaccine?
Yeah, thanks for that question, Dr. Vanderhoff. And again, we are now in November of 2021. This December is the time when we would be giving vaccines for a year. And in our country, we have given over 440 million doses of these vaccines. And unlike any other previous vaccine in the history of vaccines, on purpose, the CDC and the FDA have built very detailed mechanisms that are still up and running, by the way, looking for any adverse safety signals. So like you referenced before, in Ohio and nationally, we have given millions of doses of vaccines to teenagers, adolescents, young adults, and now those aged 5 to 11. The way we review vaccines in this world is the gold standard of the world. No other country does it in the same methodical, detailed, and transparent way. When you look at the experts, when the FDA vaccine subcommittee and the CDC vaccine subcommittees meet, those are the experts in the field of infectious diseases, vaccinology, pediatric medicine. I listen in to all of those meetings, and I feel quite confident in the way and the process that we have to get vaccines out to the public that are not, most importantly, effective, but very safe.
Thank you so much, Dr. Gastaldo. Next, I'm joined by Dr. Mary Beth DeWitt, Chief of Child Psychology at Dayton Children's Hospital. Dr. DeWitt, we know that the COVID-19 pandemic has been incredibly difficult for people of all ages, but including young people. Whether they've been asked to shift from virtual learning one year to in-person learning the next, or having to adapt to masking recommendations, or pivoting from one thing to the next as it relates to their personal and school life. So can you tell us, what are you seeing in terms of behavioral health concerns among youth right now?
Thank you for asking me to join you today. It's my privilege to also talk about children's mental health. So as an organization, I believe we are seeing what the nation is seeing, which is an increase in need, an increase in referrals, an increase in visits across our continuum of care, being outpatient psychology and psychiatry services, crisis and emergency services, day treatment and partial hospitalization services, as well as school-based and resilience services that we have integrated within the school programs. What we know is that prior to the pandemic, 1 in 5 children suffered from a mental health or condition or learning disability, but fewer than half of those children were receiving adequate support for that condition. What we now also are learning is that about 30 to 40% increase in symptoms is being identified in children post-pandemic. We have a limit in the number of services that were provided prior to the pandemic, and with access concerns, because some providers have not opened up to in-person visits again, we have a challenge in getting children the services they need. What we've also learned is that many populations may be more at risk for the negative impacts of the pandemic on them. And those may be those children who have pre-existing mental health conditions, those children who have experienced some level of previous trauma in their lives, children who live in poverty or in economic instability, and also those children who may have had increased disruption to their daily routine. We know that children thrive with routine, with structure, and with consistency. And probably many of us would say the same things, but what we're finding is that this disruption has been incredibly difficult on many kids regarding their coping and their overall adjustment. What we also know is that children are resilient and are able to utilize the strengths that they have in their day-to-day functioning, and we probably can maximize those coping strategies in our kids. It tells us that we probably should target interventions to those children who are most at risk, like we discussed, and to help them cope, while at the same time recognizing that this pandemic has been difficult on all of our mental health and well-being. 70% of individuals, children and adults who were surveyed, indicated some symptoms of psychological distress, whether that be anxiety or depression or just an overall stress response, not a diagnosable condition, but an effect on their daily functioning. So not only do we need to target interventions, we also need to utilize the support systems that we have, reach out broadly, and help everyone know that this has been difficult for all of us.
Yeah, thank you, Dr. DeWitt. You know, as a parent myself, I know well that for parents, the health and well-being of their children is really top of mind. It's paramount. And that certainly includes their emotional and behavioral health. So what are some tips that you could share with parents who want to be not only mindful of, but maybe aware of or understand what to look for, as well as what to do when they have a concern?
Absolutely. So I think the first piece of advice is to stay engaged with your children, continue those conversations, share with them how this has been challenging for all of us, adults and children alike. Many of our children take the lead from their parents in how they cope with stressors in their lives. And so opening that discussion up makes a huge difference. On a positive note, a recent study showed that 42% of teens have indicated that they feel the conversations about mental health have increased during the pandemic. So more people are beginning to talk to their kids about some of these issues. So first and foremost, stay engaged, have those conversations, keep those conversations open. Talk about how they're feeling, how they're thinking, and how this has affected them in their day-to-day lives. Additionally, remember that our teens really, and our children and our teens really focus heavily on their peer group for support and helping them find ways to stay connected with their peer group during times when we're really trying to social distance and mask and maintain our safety precautions. Parents should be creative in helping them find ways to stay connected with their peer group so that they can utilize that source of support. Other coping strategies include the things that we know help our overall health and well-being: eating a healthy diet, maintaining appropriate sleep, getting exercise, and getting outdoors. It sounds simple, but there's research to show that just being outside, being in the natural light, taking a deep breath, and getting some exercise has a positive impact on mental health. Also, knowing what crisis services are out there for you. The Ohio COVID website has many incredible resources out there for families and children alike. Knowing those resources, knowing crisis resources in your community, so that if your child is experiencing a crisis, we know what to do and we know how to follow through.
Well, thank you so much, Dr. DeWitt. Very, very helpful information. Well, it's clear that COVID-19 and the pandemic have lasting physical, emotional, and other impacts on all of us. It's also clear that the Delta variant has had its second wind and is continuing to relentlessly seek out vulnerable, unvaccinated people in Ohio. We all want to be on the other side of this thing, but in order to get there, we simply need more people to choose to be vaccinated. So I urge anyone who isn't yet vaccinated to please talk to your doctor or other health provider and get the facts about the vaccine. And now, Alicia, I think we can take questions.
Thank you, Dr. Vanderhoff. Our first question today is from Joe Ingles with Ohio Public Radio and Television.
Thank you, doctors, for doing this today. I want to ask you about the House. The House is going to be voting on a bill that prohibits schools and colleges from requiring COVID vaccines that haven't been granted full FDA approval. And that bill allows for exceptions that are so broad that anyone who wants one can get one. When you combine that with the message that ODH and health experts are saying and urging everyone who can get the COVID vaccine to do so, are state lawmakers sending a mixed message here?
Well, thanks for that question. I haven't seen the legislation or the information, so I really can't comment on it directly. But I would underline the message that you pointed to medically, which you're hearing from both Dr. Gastaldo and from me, which is our vaccines really are the safest and most effective way to protect ourselves, including our children, from the ravages of COVID-19. And as doctors, we're strongly encouraging families, individuals to choose to receive the COVID-19 vaccine.
Thank you, Dr. Vanderhoff. Our next question is from Jordan Laird with Dayton Daily News.
Thank you, doctors. This is for Dr. Vanderhoff and whoever would like to weigh in. Are these increasing COVID numbers signs of a fifth surge, a winter surge beginning? And how large do you predict it will be compared to last winter?
Well, thanks for that question. I think that's a very natural question that pops to all of our minds as we look at this Delta wave. I think what this Delta wave is telling us is what we said at the very beginning of it, that this is a very infectious form of the virus that in previous experience in other parts of the world where it hit earliest, tell us that it relentlessly seeks out anyone who is not well protected. And the best protection that we can offer you is to be vaccinated. Our vaccines are standing up very, very well, particularly in protecting us against the most serious outcomes, which would be hospitalization and death. And we, of course, have access now to booster vaccinations that can help bump up that immunity even further and provide us even protection against mild symptomatic disease. So I think what we should be looking at is our opportunity to protect ourselves and those who are around us. You know, in terms of the shape of this wave, it really is not something that should entirely surprise us. It's sort of having an M shape to it. That's something that we've observed before with COVID-19 and previous waves, and certainly something that's been seen with the Delta wave in other geographies. The key, though, is vaccination. Zones, areas of the world where vaccination rates are very high are doing very well compared to those where vaccination rates are low. Dr. Gastaldo, this is, if there ever were an infectious disease question, this is it. And so what would you add to my comments?
Thanks, Dr. Vanderhoff. That's a very good question. And I think you hit it right on the nail. The fact that we are seeing more infections during the winter months is not surprising. You know, there's a lot of factors that really cause that. Obviously, we're indoors more, we're outdoors less, we're safer. When you're indoors, we need to pay attention to the ventilation of air. We all have COVID fatigue, including myself. People want to kind of forget about the mitigation recommendations that we've been following for a while. This is really not a time to let down on what we have been living with now for coming up on 2 years. Like Dr. Vanderhoff said, we really need to be cognizant of the best weapon we have, and that is a vaccine. We still have work to do in the state of Ohio. Yes, we have made great strides in getting vaccines into people. 85% of those 65 and older are reported to be fully vaccinated. That's wonderful, but we still have to worry about those other 15%. Within our 88 counties, there is different vaccine uptake from county to county. We need to really have a crafted message to our citizens in those areas. We need to talk about boosters. Vaccines don't work in all people, especially the older you get, or if you have underlying medical conditions. We have the tools we need to get us through this. It's just a matter of respectfully engaging everybody to really ensure people have the information they need so they could choose to get vaccinated.
Thank you, Dr. Gastaldo. Our next question is from Dan DeRose with WOIO.
Good morning, Dr. Vanderhoff and your colleagues. Very interesting here in Summit County, here in Northeast Ohio. They're doing drive-through drive-through testing the Tuesday before and the Tuesday after Thanksgiving. Sort of this idea that, well, if you're heading out of town to go to be with relatives, why not get tested before you go and get tested when you come home? Do you support that? Would you like to see more people take that into consideration? But then how do you address people that say, boy, do you really want to ruin Thanksgiving on your way out of town by finding out you're COVID positive?
Yeah, I totally get that. I understand that sentiment. What I would say is, and it's certainly true with COVID, knowledge is power. So the more that we know about our status as it relates to COVID, the better decisions we can make, the smarter we can be. But we should not subject the people we care about the most to the risk of getting COVID-19 if, in fact, it turns out that we have a COVID infection. Now, remember that many, many people who get COVID-19 have minimal to no symptoms and yet can spread the virus to other people. That's particularly true for people who enjoy the really great protection against severe illness that comes from a vaccine, but maybe getting out a ways from their initial vaccine and be ready for a booster but haven't gotten it yet. Those folks could have a mild infection and not even know it. And wouldn't it be a shame to go to a Thanksgiving celebration and cause a dearly loved one of ours to come down with COVID and, God forbid, end up in the hospital or even worse, dying from COVID-19? So I think the idea of getting tested before going to a family event is a great idea. I also think the idea of coming back from when we've gathered with others and checking to see, I wonder if that gathering put me now at risk for going back to work and sharing COVID-19, and getting tested to validate that, another great idea. But fundamentally, they're really the basic principles that Dr. Gastaldo and I outlined, which begin with vaccination and include common sense steps like not gathering if we know we're sick. We've got symptoms. Don't say, I think it's just a cold, or I think it's a mild case of the flu. Those symptoms need to be paid attention to. And we should refrain from that in-person gathering. And, we're all getting pretty good with Zoom. Maybe we can sort of have our own little at-home turkey dinner and Zoom in to see the loved ones that we're not going to gather with. Dr. Gastaldo, again, this falls squarely into your area of expertise. What would you add?
Yeah, thanks, Dr. Vanderhoff. And that's actually a great question. Another tool we have in the box is testing. Our testing capacity today is much better than what it does a year ago, and that includes home testing. But again, another tool in the box, these layers of Swiss cheese that we've been talking about. Obviously now we have the layer of vaccines, but another layer in the right context is getting testing done. So for example, if you're going to have a Thanksgiving get together with elderly people, at-risk people, and we all have elderly and at-risk people in our families. Another layer of protection is to test yourself if you're going to be traveling or having a dinner with them. And again, having holidays and getting together can be done safely. We just need to be cognizant of many things that we've been talking about. Get vaccinated for COVID, get vaccinated for flu, pay attention to your symptoms. If you're not feeling well, don't put anybody else at risk. And something else to consider too, especially in the setting of high community transmission, which right now is all of Ohio's 88 counties, is to consider getting testing done.
Thank you. Our next question is from Lindsay Mills with WBNS 10 TV.
Good morning, and thanks for taking my question. We're talking here about cases on the rise, hospitalizations on the rise, and my question is about preparation. Are we prepared for what could be this Delta variant catching a second wind? And we talk a lot about stress on hospitals with staffing challenges and whatnot. So, are we prepared? How are we prepared? What discussions are underway as we start to see this trend?
Well, thank you for that question. And the good news is that here in Ohio, we have maintained a footing of preparation throughout the pandemic. Our meetings with our hospitals, whether they be our regular meetings with the Ohio Department of Health and our children's hospitals, or the Ohio Department of Health and our adult hospitals, have continued unabated over the last weeks and months. So we continue to not only monitor closely for the activity of COVID-19 in our communities, but also in our hospitals, and to have daily dialogue where needed about how best to address the hospital-based health needs in every community. Understanding that there are going to be times where a given location or a given hospital may encounter the need for help. They may need more equipment. They may have more patients at their door than they're able to cope with. And that's where our infrastructure has, throughout the pandemic, come into play. And we coordinate to assure that those patients are going to get the care they need with the help and support of other hospitals and the state, especially the Department of Health. So I believe we're very well prepared. I think that we've demonstrated throughout this pandemic a nimbleness that, frankly, other states envy. And I'm really grateful for the fact that here in Ohio, we have a level of community-focused collaboration that is just simply greater than what is seen in many other geographies in our country. And I think a lot of that has to do with the character of the people of Ohio. I know, again, Dr. Gastaldo, your work in the greater Columbus community is at the front lines of that kind of responsiveness. What more would you add?
Yeah, thanks, Dr. Vanderhoff. And thanks for that question, Lindsay. I think Ohioans need to appreciate and really understand that we've been doing this all along for the last 2 years. Within Central Ohio, there are still regular meetings between the leaders of all 4 healthcare systems. We support each other when needed. We have an exchange of ideas for what may be working better than others. And I can tell you anecdotally myself, once a month, I have a touch base virtual meeting with infectious disease physicians in all of the Central Ohio healthcare systems, where we share ideas, talk about things, talk about challenges. And that process has been happening now for 2 years. So I do feel confident that we are in a good shape, and this has been going all along now for 2 years. And I feel closer to my infectious disease colleagues at Ohio State and Mount Carmel, more so now than even before COVID-19. So again, those processes have served us well. We have a lot of communications and support from Columbus Public Health and Ohio Department of Health, and that background conversations and infrastructure is still in place.
Well, one thing I think I'd add before we close on this question, though, is that the opportunity to help protect our hospitals and to help assure that the healthcare resources all of us depend on are there when we need them is not just the responsibility of the hospitals and the Department of Health. It's also each and every one of our personal responsibilities. And that's why we're asking for people who haven't been vaccinated to please consider getting vaccinated, because it's very clear. The vaccinated are not the people, by and large, who are filling our hospitals. And they are certainly not the people who are having the most severe illnesses. The vaccinated are well protected. If all of us were vaccinated, this really wouldn't even be a hospital issue or problem. We're really at the point in this pandemic where we can think of COVID-19, especially when we think about hospitalization and death, as a vaccine preventable illness. So I plea with everyone out there across Ohio, if you haven't been vaccinated, if your eligible child hasn't been vaccinated, please make the decision to go out and get that done, because you'll be helping not only yourself and your family, you'll be helping all of your community.
Thank you, Dr. Vanderhoff. Our next question is from Alexis Moberger with ABC6.
Thanks for taking our questions. Some schools are now planning on relaxing mask mandates after winter break, encouraging students to get the vaccine. But do you think there is still a risk if kids aren't wearing masks in schools, especially in winter and as we start to see more flu cases?
Well, if we look at today's numbers and we look at the fact that we're continuing now to see increases, sustained increases in the key measures of the activity of this virus, it tells me that not only are we at a high level of transmission all across the state, but that high level of transmission, if anything, heading into the holidays is on the rise. With that context, our clear and longstanding recommendation for masking in the school environment, I think, remains. That does not take away from the fact that the vaccines provide robust protection for our school-aged children, and that we might be thinking differently about this. In fact, I'm sure we would if our vaccination rates in our school-aged population were much higher than they currently are. Frankly, if all of us had received the vaccine back when we first became eligible for it, we probably wouldn't be looking at the Delta wave that we're looking at. So I think our recommendations remain what they have been. We're at a time of very high rates of transmission. During those high rates of transmission, everything comes to play. Get vaccinated if you're eligible. Masking continues to be a prudent step for us to take, particularly when we are gathering together in places like school. And use good common sense as it relates to washing one's hands, not going into public places, including schools, when we are feeling ill, etc. Dr. Gastaldo, what have I missed? What would you add?
Yeah, and Dr. Vanderhoff, thanks for the question. You know, the context of COVID now, we really need to pay attention to how much community transmission is. In Ohio, like I said a few moments ago, all 88 counties are high-level community transmission. To be honest, I see them staying this way at least through the winter months. And you know, we know that masks do serve a purpose, especially when you're having a significant amount of people who are not vaccinated mixing with people who are vaccinated in the same room. That same guidance applies to any business, any public gathering, and it does apply to schools. You know, the experts in children's health and well-being, the American Academy of Pediatrics, strongly endorses as a mitigation recommendation for children to wear masks in school. Nonetheless, children now have access to the best layer of protection, that is a vaccine. We have an FDA authorized and CDC recommended vaccine for all children aged 5 to 11. That is the most important thing to really focus on to have children in school safely.
Thank you, Dr. Gastaldo. Our next question is from Morella Porter with WKYC.
Hi, just wanted to clarify, I'm with WKRC. Good morning, everybody. My question is about a study that was recently published by the CDC that shows that 30% of hospital workers nationwide were unvaccinated, and that was as of mid-September. I wanted to know if there was any idea what that percentage looks like here in Ohio.
Yeah, thank you for that question. Of course, I think that study and this question highlights the importance of all of us who are eligible taking up the challenge and rolling up our sleeves to get a vaccine. Again, best way that we can protect ourselves, also the best way we can protect those who are around us. You know, in terms of hospital-specific numbers, I don't have those immediately at my fingertips, but I do know this. Our hospitals all across the state have been working very actively with their teams, working with their doctors, their nurses, their many associates who help with the delivery of care each and every day to strongly encourage vaccination and to get those rates up as high as possible. Dr. Gastaldo, within your health system, to whatever extent you're comfortable, what would you say about that effort?
Yeah, thanks, Dr. Vanderhoff. And again, at OhioHealth, we have over 20,000 of our associates vaccinated. We're still gathering data on that. And, there are a lot of people out there who are vaccinated who have not yet disclosed their vaccination status. So we're still gathering that. However, I do want to really highlight that we still need to be respectful to people who are not yet vaccinated. I've been on point for the last several months now, really respectfully engaging hospital associates who have not yet been vaccinated. I know nobody wants to be told what to do, but it's the current situation that we're in. And we really have an obligation to respectfully engage our colleagues who are not yet vaccinated. And it really boils down to two things. One, people have questions or concerns that matter to them who cannot get their questions or concerns answered. And number two, people who have gone online or from social media and who really do believe and follow misinformation that's out there. I'm not giving up on anybody personally. I really want to sit down and talk with those people from a vantage point of caring and understanding. Yes, we have work to do. All hospitals have work to do in that regard. There are mechanisms in place for people to seek medical and religious exemptions. All hospitals have those up and running. But as an infectious disease doctor, I really want to sit down individually. I know I'm only one person, but I really am honored and humbled when people individually reach out to me to want to talk about questions and concerns that matter to them.
Thank you. Our next question is from Peyton Marshall with Fox 45 and ABC 22.
Thank you so much. I kind of want to take it back to the children as many of the kids are back to in-person learning. My question is a lot of teachers have been talking about how hard it's been for kids to transition back to that in-person learning, especially for those younger grades, as the time that we've been out for shutdowns or hybrid learning are really the years where they had those foundations for emotional and social skills. So my question really is, how can, teachers, how can parents really help further this transition and help build some of those skill sets that were lost?
Well, thank you. That's a great question. Let me begin by saying that we've learned a lot through the course of this pandemic. And one of the things that we've learned is that for most children, they benefit the most from the opportunity to participate in in-person learning. So the value of in-person learning is something that has been underlined by our experience with the pandemic. And so many of the efforts that you're well aware of that we've undertaken here in Ohio to increase the opportunity for our students to participate in in-school learning have been the result. But your question, I think, speaks very directly to Dr. DeWitt's area of expertise. And so, Dr. DeWitt, I'll turn to you for further insight into this really important question.
Sure, thank you so much. And truthfully, the research is showing that educators do have concerns regarding maybe lack of opportunities or falling behind academically, and additionally on that anxiety about returning to school. We also know that research says that kids do better with a routine and with a predictable structure. And so having kids back in school is important safely. And also it's important to recognize that there may have been some missed opportunities during in-person learning, and we probably have to do some reteaching and relearning to help our kids get caught up. Parents can continue to communicate with their educators and ask what can they work on at home to help with that development. And how can we help ease them back with the anxiety that maybe the children are experiencing returning to in-person learning? I think it's a process that we're all going through together, recognizing that it may be an issue and planning and being mindful of helping our kids not only catch up, but move forward in their academic environments.
Thank you, Dr. DeWitt. Our next question is from Courtney Francisco with WCPO.
Hey, I have some viewer questions here too. Do you recommend workplaces require boosters? And, some people are talking about vaccinated ending up in the hospital. So as that, relates to boosters as well, what would you have to say to them about that?
Yeah, well, thank you. I think that the question about boosters is a really important one for all of us to be thinking about. Given the numbers that I shared previously, 6.6 million Ohioans who have in fact already rolled up their sleeves to receive their primary vaccination series. There are a lot of us who have to think about this issue. And what I would say is that we highly recommend that anyone who is eligible for a booster get the booster. Why? Well, it's not that the primary series is not continuing to offer a very significant level of protection, because it is. The reality is that for most people, particularly those under the age of 65 or those who don't have an underlying immune issue, the boosters continue to do, the primary series continues to do a very good job of protecting us against serious illness and death. But we are seeing that over time, there is benefit to boosting our immunity, to taking that underlying immunity that we've gained from our initial vaccine and bumping it up to help protect us against more mild infection or being at risk for inadvertently getting and then spreading the virus to others. So there's a clear benefit to those booster shots, and hence at the Ohio Department of Health, we continue to encourage those, just as we encourage those who've not yet received the vaccine to get that. But we have been consistent in encouraging that within the context of people making an informed decision. Dr. Gastaldo, boosters, important topic, and I think important for people to understand how they relate to that primary vaccination series in terms of protection. What would you add?
Yeah, so, talking about vaccines and immunology is very nuanced. Vaccine effectiveness is a word that we use to really describe how well vaccines perform in the real world. There are many things that impact vaccine effectiveness, and I'll give you some examples. First of all, specifically, the patient. We know, and we've known for many years with other vaccines don't work as well the older you get. That's why when it comes to influenza, for those above the age of 65, it's recommended those people get influenza HD or high dose. That applies to the COVID-19 vaccines too. Perfect example is Colin Powell. Colin Powell died of COVID-19. He was 84 years old. Vaccines don't work as well in that age group. He also had cancer of his immune system. He had multiple myeloma. That's one example of real world impacts of vaccine effectiveness. Another thing that impacts vaccine effectiveness is how much community transmission there is going on out there. With more community transmission, vaccines are less effective. Now, talking about boosters, as Dr. Vanderhoff mentioned, does not mean the vaccines aren't working. However, for most people who get vaccinated, what you're really doing is topping off your antibody levels for the next several months. Antibody levels, high antibody levels, offer great protection against infection. In fact, at the FDA today, they are going to review Pfizer's booster study, where they had 10,000 people who were all fully vaccinated. 5,000 of them got the booster and 5,000 of them got the placebo. For those who received the booster, the vaccine efficacy was back up in the 95% range against preventing symptomatic COVID-19. So again, the vaccines are still working, but we really need to be cognizant to follow booster recommendations as they come out from the CDC.
Well, in that case, should workplaces start requiring it too, since some have already required the standard vaccine doses, and it can help prevent community spread?
Well, in terms of what decisions a given business or enterprise undertakes, we have not opined on that. We have not been in any way directive. What Dr. Gastaldo and I are talking about today is good medical decision making and really good medical recommendations that we'd ask every Ohioan to think about. When it comes to vaccines, Dr. Gastaldo and I think the medical community broadly are strong advocates for the vaccine as the safest, most effective way to protect ourselves from COVID-19.
Our next question is from Madison Tromler with WFMJ.
Hi, thanks for getting to me. We noticed a discrepancy between the number of COVID cases reported on schools' websites versus the number of COVID cases posted on the ODH website. So I have a couple examples too. For Austintown local schools in Mahoning County, it says there's 26 active cases, but then on the ODH website it says there's no cases reported under the new cases. And then for another school, Poland local schools in Mahoning County, it says there's 13 current cases, but then on the ODH website it says no new cases reported. And then it says they've had 2 positive student cases cumulatively on the ODH website, but on their website they've reported 13 students cumulatively. So why is this, and is there a lag, and how long is the lag, and is there a concern given parents might not have this clear COVID case information since not all schools post their COVID cases?
Well, thanks. It's a great question. I really can't answer the specifics of the situations of the cases that you've outlined. What I can tell you is this. The reporting of infectious diseases follows a very prescribed path, not only in Ohio, but across the country. It's entirely possible for any reporting that there could be minor delays in that cascade of information. But offline, our staff in infectious diseases can certainly take a look at your inquiry and offer some more specific answers. But rest assured, the way the system is structured and designed, within a reasonable time period, we do at a state level capture all of the data.
Do you guys have
Thank you, Dr.
lag at all?
Vanderhoff. Oh, I'm sorry. Sorry, Madison. We can get back to you via email on the rest of that question.
Thank you.
Our final question today is from Brian Hamrick with WLWT.
Hey, thanks. I appreciate you guys taking my question here. The first one is that, today the FDA is meeting. The CDC could also approve these boosters by the end of the week. What kind of an impact do you expect that to have in Ohio, if any?
Well, thanks. As it relates to the booster recommendation, what I would anticipate is that actually the messaging around boosters and booster eligibility has the potential to become simple, easier for people to understand. So I think one of the benefits of what the FDA and CDC are considering over the course of the next 24 hours or so would be messaging that would be a lot easier for people to understand. And I think that will have a beneficial impact on booster uptake. Part of the challenge right now is in my interactions with people around the booster question, I think people just have some confusion. And I think the FDA and CDC are doing exactly the right thing, moving very quickly to, in a structured and scientific way, look at the question and say, can we refine this and get messaging out that is simpler and opens the vaccines to people who are likely to benefit.
The other part of that I wanted to ask was that the Kentucky governor just signed an executive order to allow anyone over 18 to get the booster ahead of the CDC ruling, which could come this week. Is there any advantage to that? And do you foresee Ohio following that same procedure?
Well, first of all, Dr. Gastaldo referenced something in his comments earlier that I noted and agree with completely. And that is that here in the United States, we really have the gold standard, both for how vaccines are evaluated and how guidance is developed and communicated across the country. I believe very strongly in the benefit of working closely with the Advisory Committee on Immunization Practices, which is a body whose charge has been for decades to look at vaccines, look at the science and the facts surrounding those vaccines, and provide medically directed guidance regarding what people should do. The fact is that they are meeting to discuss this over the course of the next 24 hours. And at this time, we see no reason to jump the gun and act in any way that would be not in concert with their efforts. So we're really very confident that the process will work as it is designed to work, and that we will have guidance to share more broadly as we head into the weekend. We await that guidance from the ACIP, and rest assured, Ohio stands poised and ready to go with whatever that evolved guidance calls for.
Thank you, Dr. Vanderhoff. That was our final question today. If you'd like to share any final closing remarks before we conclude.
I just want to thank everyone again. We continue to be in the midst of this Delta wave. Again, I've said in the past, I think there is light at the end of this tunnel. I think we can all see it, but there's more work to be done, especially the important work of getting as many Ohioans vaccinated as is possible. Thank you all very much.